Yes. Hello everyone. I'm Dr. Sangita Chauhan. I'm obstetrician and gynecologist at Equare Hospital, Aurangabad since 15 years. I'm thankful to BabyChakra for having me the opportunity to speak in front of all Facebook viewers for live chat. My topic is exercise in first trimester of pregnancy. We all know exercise is important not only in our day-to-day life but also in pregnancy. In this session, I am going to speak on exercise in first trimester of pregnancy, that is, in early months of pregnancy. Why exercising in first trimester of pregnancy is important? In first trimester, there are all structural and organ developmental changes taking place in the baby. Therefore, the physical and mental condition of mother affects the growth of the baby. Therefore, it is very important for pregnant women to stay fit and strong physically as well as mentally. Exercise plays important role to keep the pregnant woman fit and active. My aim in this session to establish a good pregnancy routine in pregnant women. It helps in giving better pregnancy outcome. It means healthy baby to healthy mother. Getting started, we know that pregnancy is divided into three parts. Each part is of 3 months. First trimester means early 3 months of pregnancy. It means embryonic or very tiny form of baby. The question comes, can pregnant women start exercising in these early weeks of pregnancy? According to International Association of Obstetricians and Gynecologists, all pregnant women with uncomplicated pregnancies can participate in exercising, provided they should consult their obstetrician before starting any pattern or any type of exercise. Another question comes, how is exercise is beneficial during pregnancy? As we know, exercise is easy way to improve mental as well as physical well-being during and after pregnancy. Regular exercising helps in reduction of morning sickness. That means many pregnant ladies have nausea or vomiting early in the morning. Regular exercise helps in reduction of this morning sickness. Regular exercise also helps in reduction of anxiety, stress level, emotional outbursts, and it prevents pregnancy, post-pregnancy psychosis also. It is helpful in reduction of fatigability. Regular exercise helps in improvement in the sleep level, sleeping pattern. It helps in elevating the mood. Regular exercise helps in increasing the day-to-day physical activity, and therefore it leads to easy childbirth due to improved joint flexibility and muscle strengthening. Because of the regular exercise and improvement in the physical activity, it helps in control weight gain during pregnancy, which again helps in reduction in the risk of gestational diabetes mellitus. It also reduces the risk of increased blood pressure during pregnancy. It helps in reduction of overweight baby. Therefore, exercise in pregnancy is beneficial as it increases the chances of normal delivery and reduces the chances of cesarean section. Exercise improves the abdominal and pelvic muscle strength and tone by doing Kegel exercise, and thereby it reduces the occurrence of constipation and piles. At the same time, it also pelvic floor muscle exercise also helps in reduction of urinary leak and urinary incontinence that happens during pregnancy. Let us see what are the risks of doing exercise in first trimester of pregnancy. Any strenuous kind of exercise is harmful because it places too much pressure around the uterus and baby. Therefore, excess strenuous form of exercise, it leads to hyperthermia or increased body temperature, that is 102 Fahrenheit body temperature, and which may lead to neural tube defects in the baby. Excess or strenuous form of exercise may lead to excess sweating, thereby dehydration, thereby it leads to decreased blood glucose level, and sometimes because of the strenuous exercise, it harms the pregnant woman and thereby it reduces the maternal fetal blood flow. Sometimes there is separation of placenta from the uterus leading to abruption. These are some of the risks that happens because of the strenuous kind of exercise. Then now we see that prescribing the a pattern of exercise in pregnant women. Can all pregnant women do the exercise during pregnancy? According to International Society of Obstetricians and Gynecologists, all pregnant women with uncomplicated, that means there should not be any pregnancy complication, then they can do the exercise, provided that once their pregnancy test come positive, they should consult their obstetrician and they can do regular exercise. Pregnant women which cannot do the regular exercise, or what are the contraindications of doing exercise during pregnancy, like the pregnant women who have history or previous history of miscarriages or abortion, or history of preterm labor, that means delivery before the term, before the 9 months completion, then the pregnant women having vaginal bleeding or leaking per vagina, pregnant women with low lying placenta, pregnant women with medical illness, like if women is having heart disease or chronic obstructive lung diseases like bronchial asthma, women with seizures or epilepsy, झटके आना बोलते हैं उसको, epileptic attacks, in such kind of medical illness, the women are prohibited from doing exercise during pregnancy. There are some standardized questionnaires and resources are available as a screening process. The type of exercise recommended depend upon the exercise tolerance and stamina of individual pregnant women. So how to choose the type of exercise? We know there are two types of exercise, that is low impact exercise and high impact exercise. Low impact, all types of low impact exercise can be done during pregnancy. The low impact exercises are Kegel exercise, then walking, swimming and water aerobic exercise, standard cycling exercise, yoga and meditation. These are some kind of low impact exercise. Low impact exercise, that means Kegel, that is pelvic floor muscle exercise. It means the contraction and relaxation of pelvic floor muscles, and because of it, there is improvement in the strengthening and toning of the pelvic muscle, and it helps in relieving the urinary problems, constipation, and piles. This exercise can be done 3 to 4 times a day. Another form is walking. It is the simplest form of exercise. It helps in joint flexibility and laxity. Another important exercise is swimming and water aerobics. It improves the blood flow and stamina. Stationary cycling, routine standard cycling is not advocated during pregnancy because of the risk of falling down. But stationary cycling is a better option for doing exercise. Yoga and meditation is another simple and most important form of exercise. It helps not only in physical well-being, but also it helps in psychological well-being. Meditation helps to make you strong mentally, so that any emotional upset during pregnancy which are happening due to pregnant hormonal changes of pregnancy, this can be tackled by doing meditation. High impact exercise like forward bending, backward bending, twisting of the abdominal muscles, this should not be done during pregnancy. Hot yoga like exercise, because of the it increases the body temperature, and because of this hyperthermia, that is more than 102 Fahrenheit temperature, it leads to there is a chance of neural tube defect in baby, so hot yoga is not advocated. Contact sports like boxing, soccer, gymnastics, horse riding is to be avoided during pregnancy because of the risk of falling down. Scuba diving and skiing is not done. Then what will be the frequency and duration of exercise? Each pregnant woman can do exercise 25 to 30 minutes per day, and the frequency should be 4 to 5 days in a week. But those pregnant women who are not doing previously exercise before becoming pregnant, those women can start exercise as little as 10 to 15 minutes daily with 3 days per week, and then gradually they can increase the frequency and duration of their workout depending upon their stamina and comfort level. How to monitor that this exercise is sufficient? Every woman's body constitution and stamina is different. Therefore, you have to watch for your pulse rate. It should not exceed 1.5 times of your basal pulse rate, and see for how much your body is able to perceive the exertion. Most important, your tolerance level and comfort level. It should not cause this exercise should not cause any type of shortness of breath. If you have shortness of breath, palpitations, excess heart rate, vigorous breathing, that means unable to talk, if you feel tired after exercise, if you feel nauseated and vomiting, then you should reduce the intensity and duration of exercise. When to stop the doing exercise? If you have vaginal bleeding or leaking, if there is breathlessness, dizziness, headache, chest pain, muscle weakness or cramp, sometimes if you have calf pain or swelling over the legs, in such circumstances, you should stop exercising. There are some do's and don'ts of exercise in pregnancy. Do's of exercise in pregnancy: while doing the exercise, you should wear loose fitting cotton clothes. Same, you wear flat non-slippery shoes. Maintain proper hydration pre and post exercise. Set possible targets of doing exercise and try to fulfill them daily. Recognize when to stop exercise and watch for pulse rate and breathing pattern. Don'ts of exercise are: don't wear synthetic or tight fitting clothes while doing exercise. Don't wear slippery shoes. Don't do any strenuous kind of exercise which may harm the pregnant lady, and there is a chance of separation of placenta from uterus, that is abruptio. And don't go for heavy exercise again because of the hyperthermia, because of the increased body temperature. There is a risk for baby. Don't do sudden jerky movements, forward bending or backward bending at the same time. Don't do twisting of the abdomen also. So this is about the exercise in pregnancy in first trimester. If you have any queries, please do post on FB Live Baby Chakra. Post them to Sangita C. I'll be happy to answer your queries. Thank you, Baby Chakra, for having me with you. Thank you all and take care and keep on exercising. If you have any queries, please do post it. Yeah, there are some questions. Any remedy, this Jenny, she is asking, any remedy for swollen feet? Yes, don't go for prolonged standing on feet first. While sleeping, you can use pillows over the below the feet so that the swollen feet can be reduced. Jenny is asking, for how long should I walk? It depends upon the individual's pain tolerance. Then you can walk. It is not recommended that this much amount or this much intensity you can walk. It is not like that. Depending upon individual's pain tolerance and capacity, you can do walking exercise also. Then Jenny is again asking, "Hi doctor, how to stay fit throughout pregnancy?" Just now I told that keep on exercising daily, maintain your regular rhythm of exercise or set pattern of exercise, and then you can have good sleep and have good hygiene also, maintain good eatables also. In this case, you can remain fit throughout pregnancy. Bhavna is asking, can you get back pain from back pain during pregnancy? Actually, Bhavna, I'm not getting your question that can you get back pain. If it is like that, that back pain during pregnancy is continued after pregnancy also, then yes, in this case, this back pain during pregnancy, maybe there is continuation of this pain in post pregnancy also, because of the stiffness of the joints and because of the overstretching of the back muscles while delivering. There is a possibility that the back pain may continue. That's why I'm again insisting on doing exercise during the pregnancy, so that it can strengthen your pelvic muscles and back muscles, so that any stress of the labor you can come over that. Babita Sahani is asking, why do you have back pain during first trimester? Yeah, having back pain in during first trimester of pregnancy is also common. This is because of the growing baby. It put a lot of stretching over the uterine musculature, and there is a referred pain is there in the pelvic muscle, and there is back muscle also, and that's why there is pain during first trimester. Sometimes in early weeks of pregnancy, patient is unaware of that she is pregnant, and there may be some jerky movements, forward or backward movement, and that is the one of the reason that having back pain during first trimester of pregnancy. Then how many counts, Durga Salvi is asking, how many counts of squat, butterfly exercises, duck walk, stair climbing has to be done? Actually, Durga, just now I told that every pregnant woman's body constitution is different. Every individual's stamina is different. So depending upon their capacity to perceive the exertion of this exercise, you can set the limit of counting of squatting, butterfly exercise, duck walk, or stair climbing. Sonam Patel is asking, can pelvic pain be associated with pregnancy? Yes, it is very common that pelvic pain may be associated with pregnancy. Again, because of the growing baby that put excess pressure on the uterine musculature, and because of that, there is a referred pain which occur in the pelvic area also and in the back muscle also. So, pelvic pain sometimes it is associated with pregnancy. Revati Rajmani is asking how to stretch lower back during pregnancy. Actually, stretching of lower back muscle, it is good exercise during pregnancy. It is very simple exercise that you can sit on the chair with your feet flat on the ground and one foot, put your one foot on the knee of another foot so that it can make a position of four, and then just do exhale and don't bend forward, just lean forward. Then it leads to stretching and strengthening of your back muscles. This is good pregnancy back muscle stretching exercise. Then the Madhvi is asking how to manage back spasm during pregnancy. There are various causes of back spasm during pregnancy, like because of the pressure of gravid uterus on the sciatic nerve, there is back spasm. Because of the jerky sudden movements, there is back spasm. Sometimes patient may do strenuous kind of exercise. It may lead to back spasm during pregnancy. Overweight of the uterus, gravid uterus, and because of the tilting of the hip joints while walking, there is a back spasm. There are a number of reasons of back spasm. So you have to see what is the exact cause. And another thing, we have remedies like hot pack fermentation, which improves the blood flow in the pelvic and back muscles, as well as some ice pack fermentation, which decreases the inflammation over the back muscles. Sometimes to maintain good posture so that the straightening of the spine. Same time, do some light massaging over the pelvic or back muscles, and it reduces the back spasm during pregnancy. Then Lakshmi Misra is asking, when can I start my postnatal exercise? I had cesarean section delivery. Lakshmi, actually, if you had cesarean section is a major operation, so you should not be hurry to do the exercise. But because early 6 weeks are required for the healing process after the cesarean section. But still, after that means after 6 weeks or after the 3 months of the post cesarean section, you can start some pelvic muscle exercises like Kegel exercises, and some abdominal and pelvic muscle toning exercises like pelvic tilt or pelvic bridges. These are good exercise that they can tone your abdominal muscle, and they reduce your abdominal tummy also. Lakshmi Mishra is again asking, I had cesarean section in just 63 days ago. Can I do exercise, or when should I start exercising for tummy reduction? Yeah, just now I told the answer that you can start your exercise like pelvic floor muscle exercise, that is Kegel exercise. This is good. Pelvic tilts are good. Leg slides are good. These are some kind of exercises that tone your abdominal muscles as well as pelvic floor muscles. And once you get accustomed with this kind of exercise, then you can increase the frequency and duration of exercise. Then now Lex Kapoor is asking, hello doctor, we are always have lots of confusion about exercise during pregnancy. My question is, if we aren't doing any exercise before, can we start during pregnancy? Navax, I know that many pregnant ladies have confusion about exercise during pregnancy. I hope my topic of this exercise during pregnancy is helpful for you now, and it will somehow relieve your confusion. Then the question is, if we aren't having any exercise before pregnancy, then can we start during pregnancy? Yes, you can start doing exercise after pregnancy also and during pregnancy also. First of all, once you become pregnant, get consultation with your doctor, see your all parameters, these are normal, and if you have uncomplicated pregnancy, then you can start doing exercise at any trimester, that is any months of pregnancy, no problem. Then can we, Novak Kapoor is again asking, can we do any exercise if have low-lying placenta? No, for low-lying placenta, one should not do any kind of exercise because of the risk of vaginal bleeding. Didi, Coco. So thank you guys. Take care.